Welcome to the Dr. Berkson's Best Health Radio Show. And today we've got a show I'm going to call Patient Tales and Bits and Pieces. I've been a real Netflix binger lately. I work really hard and then I want to relax, and I Netflix binge sometimes while I'm at the gym. I love to listen to shows after I've heard and seen them once in real time. Then I can just listen to them. And there's this show that I think is so well written and so well acted. I like to look at every single part, the cinematography, the sound, the script, and it's called Happy Valley. And it's kind of a female Wonder Woman in the presentation of an aging, slightly chubby policewoman who's almost too good to be true. She's so authentic. And within the script, they use this phrase a lot, bits and pieces. Apparently, it's a really common phrase in England. It's not so common here in Austin, Texas. But it's all about bits and pieces, your whole shtick. So I'm going to talk on this show today about patient bits and pieces. It's a composite today of a bunch of bits and pieces of patient stories that I think will add to your tool bag and your perception of when things show up in your own life and how you might start taking a look at it. One of the stories I wanted to tell you was a very interesting case of a woman who came to me about 10 years ago, and she was a little bit overweight, and she was very fatigued, had some brain fog, common symptoms of people in middle age. She was having a little bit of problems in the boudoir, and she was also having insomnia. So after cleaning up the diet, identifying reactive foods, and getting her hormones balanced with individualized testing and replacement, she was really improved almost all across the board, especially in the boudoir. But slowly but surely, the sleep that had improved for a short period of time crept on back as a problem. And the other of having poor sleep was that she would fall asleep easily, as many people do, and then wake up in the middle of the night, as many people as we start to age and our hormones wane and our problems of life escalate do. She said the other issue when she woke up in the middle of the night was rapid heartbeat and heart pounding. I recommended she go see a cardiologist just to cross any organic issue off the list. So she went to see a cardiologist who did a real big, supposedly, workup on her and said everything was fine. There was nothing wrong with her heart. She should go home and just perhaps sip her wine more slowly before she went to bed. As time marched on, she still felt improved, though not 100%. But her problem of waking up in the middle of the night with that rapid heartbeat was consistent. We tried minerals because minerals have a lot to do with stabilizing the rhythm of your heart. When I used to work in Tulsa, Oklahoma, with a double board certified internist, he would show me how he could stabilize abnormal rhythms on an EKG with minerals. Minerals and fish oil, that were his big tricks. Of course, it's the dosage. Dosage is so important with whatever you give, and to make sure that you absorb the minerals, and as we get older, our absorption goes down. But I remembered all of that, and I really took a look at this person's minerals. We ran minerals inside the red blood cell. That's called RBC mineral. There's RBC zinc, RBC magnesium, RBC copper, RBC manganese. You can look at a wide array of minerals inside the cell because minerals are cofactors like green lights that allow step A to go to step B. They allow enzymatic actions to take place, but they do that inside the terrain of the red blood cell. So she had a few minerals that were borderline low, and we pluffed them up, but she still had that issue of waking up about 2 to 3 in the morning and feeling like she was in a little bit of a sweat with a rapid heartbeat. So I said, why don't you get a second opinion from a second cardiologist, which she did. And she got another second clean bill of health. Now, fast forward several years, And she's still basically doing pretty well, but beginning to feel a little bit more fatigued than she should feel with all the good focus and proactive steps that she's taking. And she still has that insomnia that has that atypical presentation of waking up with a flutter in her heart. And it's been bothering me. So I was in Chicago lecturing for A4M. I was one of the professors on the gut module, and I was having dinner with a gynecologist and a cardiologist from Nashville, Tennessee, who is a world-famous cardiologist. His name is Mark Houston, and he teaches in a large number of functional cardiac types of courses. He's been around for a long time. He is one of the iconic figures, the top of his field. And we were sitting there chit-chatting about all kinds of things. And I said, hey, Mark, I've got this patient that's really laying heavy on my mind. I want to describe her to you. And I'm thinking of encouraging her to come see you, which he is a direct pay doc, and it's $2,000 just to see him. And then insurance covers all of the other tests. You stay there for 2 days. It's $2,000 well spent because you've got an iconic top of the heap functional cardiologist doc focusing on you like nobody else does, because other docs these days, it seems, do such a cursory job. I mean, now she'd been checked out by 6 or 7 cardiologists and given the same mantra: you're fine. I didn't like that we couldn't get rid of her insomnia with all the other things we need to do, not just minerals, not just melatonin, not just taurine to make sure her magnesium gets better absorbed, not just making sure her adrenals had very good circadian rhythmicity so she didn't have chronic cortisol elevation at night. We were looking at her insomnia from every portal that you could take a look into it, and it wasn't going away. And I don't like those kind of problems because they mean there's usually a hidden issue way beneath the surface, the root cause that we haven't identified. So Mark, I said, over munching, and they were having a glass of wine. I don't know. I haven't really felt like drinking that much lately, so I don't think I was having a glass of wine. I was having my carbonated water. And I told him the picture, and he said, you know, I really want you to send her to me. And if she has not had a blood pressure cuff put on her on a 24/7 basis, I'd like to do that. Has she had that done? I said, no, all the cardiologists that she saw, and top cardiologists from really prestigious institutions here in the major cities of Texas, have said that she's fine and she doesn't need any kind of interventional testing like that. And he looked at me and I looked at him, and I knew that he had stuff rolling around his brain. So as soon as we finished dinner, I ran upstairs and I called. And I said, I'm going to give you a little gentle twist your arm behind your back. But I just had this conversation and I relayed it all to her. And I said, you know, your heart is such a big deal. And she said, I've seen 6, 7 cardiologists. I've been told everything's fine. I know you've been told everything's fine. I was told years ago there was nothing left to do for me, and then I could do stuff. And you never know what you're told. What you're told is just an opinion, even if they're a main doc, and even if they've just put you through a test. How crazy is that is the truth? So after really, I'd admit to you, a few conversations, not just one, she decided to fork out the dough to go see Dr. Houston in Nashville. So she couldn't get an appointment for a few months. And then the time came. She was getting a little bit nervous because she knew he was going to spend 2 full days really looking at her in a way that you don't normally get looked at. But wouldn't you want anybody to look at your heart like that? 1, if there might be a problem, or 2, if you're just getting older. So she went off and spent the 2 days at Dr. Houston's office. And then he called and he said, you know, we put that blood pressure cuff on her. By the way, her blood pressure was completely normal. Every time she went in to anybody's office, including mine, it was totally normal. Sometimes if a person's pressure is a little bit elevated, they might have white coat syndrome. You look at the doc and you're a little nervous about seeing the doc and your blood pressure might go up, although that is a little bit of a risk factor for perhaps blood pressure issues down the road because your blood pressure is a little bit more reactive to a circumstance. It had always been normal. But sometimes if it's not in my office, I'll have somebody go home and take their blood pressure the same time each day, and I teach them how to do it properly because taking it properly, which almost nobody ever does, is really part of taking a good blood pressure. But she'd done all of that, and her blood pressure was normal. On all of her charts and all of her cardiologists and everybody she's seen throughout her entire life, her blood pressure was normal. So at Dr. Houston's office, he put a blood pressure cuff on her 24/7. And right before she woke up at 2:30 in the morning, which she almost always has done for now years, and you're aware of it now too, her normal blood pressure skyrocketed to about 200 over 130. I mean, it just skyrocketed. And that's what woke her up out of a deep sleep with that fluttering of her heart. Well, he then looked further as to why that might be even happening. And with all of his years of expertise and of going within in functional ways that are diverse from allopathic, more just diverse ways, he was able to ascertain that there was one chamber of her heart that was hardening and stiffening. And there was one valve that was leaking a little bit. And it was that stiffened chamber that was creating in the middle of the night nocturnal or nighttime hypertension that was really the cause of her insomnia that none of those other cardiologists had picked up. Now, that's a scary point, but it's a gift of a point. Because if you've got a problem that nobody else is finding and you keep going to a slew of really great experts and they're not finding it, perhaps you just haven't found the right expert. He also found that she had a little bit of a leak, and he called and said, I got to say that I think that you and I really have saved this woman's life, because if she had gone on the way she had in about another 10 to 12 months, I don't even think into next year she would have had irreversible congestive heart failure. And now it's still reversible. We can fix it naturally with specific nutraceuticals. In fact, he's designed a whole line of very specific nutraceuticals for biotics, which is one of the oldest and most prestigious vitamin companies. I've been trying to get them to work with me a little bit, but I haven't been able to convince them for some reason at this point. But they did work with him to design some products that he knew he could use to change around various cardiac scenarios like this one. So he gave her a little bit of a very mild antihypertensive before she went to bed to keep her blood pressure more even throughout the night. Well, that was it. No more insomnia. No more insomnia. For years of insomnia where she goes to bed and then wakes up in the middle of the night with a flutter. None, it's gone because it was secondary to elevated hypertension that was only occurring at night, so-called nocturnal hypertension, not picked up by anybody else, but that was just a symptom of the more underlying problem, which was she had stiffening, and how this also, I forgot to mention this, she had also had, when people come to see me, usually once every decade, I have them do a fast CT scan of their coronary arteries, which you can order in most states, not all on your own, and it gives you an exact numerical readout of how much calcium you have in your coronary arteries. So you see how much plaque you have, you just don't do an estimated blood work. Like all your blood work, your lipids and everything, they're estimated. But if you image how much calcium you have in your coronary artery, it's pretty clear cut. And then also I like to have people get their carotids in their neck ultrasounded so you could take a look at the endothelial lining. The lining of your blood vessels is a flashing red light on your physiologic dashboard of the health of your cardiovascular system. And she had had some chronic endothelial thickening that didn't make sense, that it wasn't going away, doing all kinds of interventional exercise, balanced hormones, everything else, and we've been monitoring that. So interestingly enough, thickened endothelium was a suggestion that there were down deep in the basement of her body some issues, but nobody else, even her cardiologist, said, the thickened endothelium, it's just typical for your age. But after Dr. Houston saw her, he said, we could clear all of that up, and most likely we can avert the congestive heart failure that she was headed down that would have ultimately, in a fairly short period of time, been irreversible. And I have to tell you that they sent me this humongous, incredible floral arrangement as a thank you, because this was a window into their future and how to make it healthier, big time. And there aren't a lot of people who can look that deep. Dr. Houston can look that deep. I can look that deep with hormones and different complex issues. And you want an agile thinker that can look that deep. And there's a bunch of people out there that can look that deep. But a lot of times when we go to regular healthcare, myself included, to the people who are now available to us, because of the way the system is set up, there's not a lot of deep thinking going on. I thought you would want to know of that scenario. I just think that is so fascinating. And interestingly enough, right after that happened, I had another patient walk in with the same exact thing of insomnia in the middle of the night, waking up with arrhythmia and a normal blood pressure. And I recommended that she have her cardiologist request, now I'm going to always request this, a 24/7 blood pressure cuff. And he didn't want to do it. He thought the likelihood wasn't high. Well, who wants even that likelihood? So if you've got that symptom out there and you meet a doc that's not ordering something that you think you might need, or somebody that you heard or chatted with thinks you might need, go to somebody else who might order it. And if it's not covered by insurance, pay for it yourself, because that test might be the test that'll avert a shadowy future. That's a little bit of bits and pieces, and I thought I'd give you some more bits and pieces, because it's stories like these that open our eyes and open our mind and open our heart and open our vision to possibilities and ways of looking at things we hadn't realized before. And isn't that a big part of becoming an agile thinker, a more powerful person, or a more engaged person, or a more successful person, is that you can look at a situation, and your health is certainly a situation, and see it in a way that you just hadn't ever seen it before, because we tend to just give our health up, just give it up to somebody across the desk. Oh, your blood work's fine. Most blood work's pretty cursory. Your exam is fine. Most exams are pretty cursory. And we just kind of give it away rather than really thinking about it and what our body is trying to tell us is going on. And usually our symptoms are flashing red lights on the dashboard of our physiology that something is going on, and you want somebody to at least respect those symptoms. Anyhow, I wanted to tell you of another bits and pieces patient tale. So there was a young man who I was consulting with from another country, and he was very young. He was only 29, and he just couldn't think. And he had real low drive, low motivation, and he kept getting ill all the time, and he even had, on a stool sample that he tested, he had yeast infection, and he'd get rid of it, and he got it back. A lot of women get yeast infections, but he had yeast infections in his stool sample. And the other thing, when I was looking over all of his blood work and his intake, his labs over the last 6 or 7 years, and he's been seeing a lot of doctors because he just felt like he was operating on one cylinder and he just couldn't get going, is he had really low cholesterol. Now, cholesterol is a precursor molecule. So it eyes pantothenic acid across a crowded room and it says, let's date, meet, and mingle. And when cholesterol and pantothenic acid merge, they make all your hormones. So cholesterol gives birth to all of your hormones. It's the precursor, the top molecule that you make your hormones out of. And hormones run your brain. That's why my last book was called Sexy Brain, because sex steroid hormones run your brain. The lipid membrane of every one of your cell, and you want to have your cells have very flexible lipid in and get out, and that's a healthy body. Circulation into cells and out of cells. You got things humming and jamming. And if you don't have enough cholesterol, you can't have a healthy hormone set of levels on a variety of hormones, and you don't really necessarily have healthy cell membranes, and your brain is really made up of a lot of fat. You really need fat. It's not like cholesterol's a bad thing. You just don't want cholesterol skyrocketing, especially if you're a younger male with a lot of stress in your life. As we get older, women, and much of the literature really reveals that if your total cholesterol level is a little bit higher, you tend to have less dementia, less stroke, less risk of infection or mortality from infection. It doesn't exactly uphold all of our statin cholesterol theories that have been flung around. But the bottom line is he'd seen a lot of a train of doctors who all said, "We don't know what's wrong with you. Your blood work looks perfect. And hey, clap them on the back. You don't ever have to worry about heart disease. You got a really low cholesterol." So I said, it isn't normal to have a low cholesterol of one test was 115, another one was 120, another one was 130. It's not normal to have really low cholesterol, and especially in a young man, you need to make your testosterone out of that cholesterol. You need to make your cell membranes out of that cholesterol. And cholesterol helps you fight infections. Cholesterol actually synergizes with your immune system to help make you stronger as you move through a foreign world. So I decided to rerun his comprehensive stool, and there it was, a lot of yeast, fair amount of yeast in his stool. And I started sleuthing because I remembered in the back of my brain this connection between candidiasis, and there's like many, many different varieties of Candida, which is normally a fungus that's a friendly fungus among us, and it lives in our mucous membranes and inside our gut in a symbiotic way. And it doesn't really cause any issues until that symbiosis is tilted. And then it turns, it morphs, it's a Jekyll and Hyde kind of thing, and it morphs into a nasty fungus where it then roots into the gut wall, creating mycelia, little roots, gives off toxins and creates a problem, and starts becoming a foreign, non-friendly invader. So yeast can be good or bad, and it all depends on the amount of yeast there and many, many different factors. I talk about that in Healthy Digestion the Natural Way and in my new book that's going to be coming out if I can live through it. But I remembered that a number of yeast, Candida albicans, Candida glabrata, Candida perulata, if I'm pronouncing that right, some of these are kind of polysyllabic and difficult to pronounce, that a number of yeasts, I remember reading some articles that they actually use cholesterol as a little raft once they become the pathogenic, unfriendly, or foe-like yeast. They can use up cholesterol to become more invasive. They take the cholesterol that's in your body and use it up to help it do its dastardly deed. So that there can be this synergy of nasty candidiasis and cholesterol that helps it become more invasive, and your own cholesterol level can lower, making your immune system even less able to fight off the candidiasis infection in the first place. So what we did was increase herbal and pharmaceuticals to get rid of the yeast. We did a number of things. We wanted to build up the yeast wall, which most likely is damaged by all the rooting, the mycelia of the candidiasis. So I use butyrate. And there's a new product out. There's a new company called Tesseract. Al Zapp is one of the geniuses in the nutraceutical field, and he had started Thorne, which is one of the most well-respected medical nutraceutical companies. Just a brilliant gentleman, and our careers have kind of gone along parallel paths. And he sold Thorne, and then he was in a period of a non-compete where he couldn't really do much, so he started to research. And he came up with a new delivery mode for nutraceuticals, and he's just launched that product, that company called Tesseract, with nutrients in a new delivery mode that appear to have such more enhanced bioavailability that the docs that are friends of mine over at Jonathan Wright's clinic that were using his pills and nutrients for the last year to test them out had kind of miraculous response. So he's got a new butyrate product called Probutyrate. I gave this patient some Probutyrate to help build up the gut wall and a number of things like that. And because he had brain fog, also sometimes when there's a real high pro-inflammatory cytokines causing an inflammatory storm in the brain, that can be tamped down a little bit with real high dose dexahexanoic acid, which is a form of omega-3 fatty acids. And we went about this whole program like that, trying to get rid of the candida, which in the past he tried, but this time we did it by also rebuilding the gut. And then actually he's a great candidate for eating a lot of foods that are high in saturated fat, so he could bring up his digestive, his cholesterol level. But we did a liver ultrasound to make sure he didn't have a problem with his liver, and that's why his cholesterol was low and there wasn't any problem with his liver. And we gave digestive enzymes to make sure he could absorb fat, which included pancreatic enzymes and bile. And in a short period of time, as his cholesterol level elevated in a healthy manner, his hormones, which we tested, were very low than their own because he could now start making hormones out of the precursive molecules that we were allowing him to digest and giving to him. And we helped build up his gut wall. And we also did a number of other supportive interventions for his immunity so that this chronic fungal infection would not be able to conquer him. And that's really interesting. It's very easy to go from doc to doc and have people look at your labs and not notice things. That's one of the bits and pieces I want you to get. It's easy to not notice things even if you're a doc, a nurse practitioner, a chiropractor, a naturopath. You cannot notice things. You just might not think of it. You might not know that connection. You might think that it's better to have low cholesterol because you're protecting your cardiovascular system, and you don't really realize or remember that your hormones and your cell membranes come from cholesterol, and there's lots of reasons that God gave you cholesterol. So it all depends on the viewpoint of the person that you're having review your labs and your health situation. It's all about who you know. It comes down to networking, I guess, even in health. So I wanted to tell you another bits and pieces. So I had a young man, very young again, and he'd been gaining a little weight and feeling kind of tired, and a lot of like young guys these days, sitting in a module, not moving around much, so thinking that's why he's gaining a little bit of weight. And he and his wife have been trying to get pregnant. They just haven't been able to get pregnant. But when they look and test him, he's got plenty of sperm, but their shape is kind of odd, but he's got plenty of sperm. And he's got a few other things. He's got a little bit of high blood fats on every blood fat that you can have, except for the good one. So he's got high triglycerides, high total cholesterol, high low-density lipoprotein, or the bad cholesterol. I don't know if they put it like that, but there's really more subfractions of those. And he had really, really low good cholesterol, which is what your liver makes. Nobody should have below normal levels of good cholesterol. To me, that's another flashing red light on the dashboard of your physiology. If you have all other blood fats as high, but your good one is low, something is going on with your liver's ability to manage. Your liver's like the manager, the project manager of your fats. And why isn't it that your liver can make enough good cholesterol, which helps scavenge your peripheral cholesterol and bring it back to the liver to help bring balance between your good and bad cholesterol? So I just didn't like that all the other blood fats were high, the good blood fats were low. I didn't like that he was young, but he had a presentation, and there were a few other things, as I recall now. He had his thyroid checked, and your thyroid makes T4 with 4 iodine molecules, and T3 has 3 iodine molecules, and it's T3 that signals that are waiting for a thyroid signal. And you want to have T3 in kind of a normal level, an optimal level, because there's a satellite receptor on every single cell of your body. Every cell is longing to get a signal from thyroid. Signal me, signal me. Every cell wants to be signaled by thyroid. So most of us are concerned if there's insufficient T3 or insufficient signals to the thyroid receptor. But he had kind of high T3 without being on thyroid replacement. And I had just been to a conference. I'm like a conference maniac. I'm either teaching at them, or taking them. I just did one in Florida that was 25 hours of sitting. I swear my bum was the shape of the chair and flattened out. I had to plump it up at the gym for about 5 days straight when I got home. Anyway, they had discussed and given all of the cellular pathways to explain why an elevated T3 was a flashing red light of a lot of oxidative damage, especially if the liver wasn't as happy as could be. So we had very low, it was in the 20s of the good cholesterol, and we had elevated free T3. So I said, I think you ought to go ask for a liver ultrasound and rule out fatty liver. Because if you got fatty liver down the road, that's a lot of issues, but we could reverse it really quickly, and that might have something to do with the abnormal sperm shape, and you might be part of your contribution to the infertility issues. So just consider going to your doc and asking for a liver ultrasound, which this couple is fantastic, and they're very proactive. And so within a few days, he was knocking on the door of that doc, who looked at him and said, "There is no way that you have fatty liver. No way." And I don't know if she said in hell or he said in hell, but it sounded like it was with that inflection. But to their credit, when requested to get a hepatic ultrasound or a liver ultrasound, the doc said, okay, but there's just no way. You're just a young guy. You're a healthy young guy. You're a strapping young man. So it came back that he had fatty liver up the wazoo, which will lead to the road of dysinsulism, obesity, type 2 diabetes, and perhaps even scarring, fibrosis, all kinds of nasty stuff with your liver. It's not a good way to go, and you really can't lose weight ever with a fatty liver. You have dysinsulinism you can't conquer, which keeps your fat cells from responding to your weight loss efforts. So from just a weight loss effort alone, you want to make sure you don't have fatty liver, but from a disease down the road, you definitely don't want a fatty liver. And your liver is a very happening organ. If you were to stick a thermometer in there, it's about 107 degrees in there because a lot of stuff is going on in there, and I'm sure it contributes even to sperm production. Even though it's totally different from where sperm is made, it has a lot to do with hormone balance, which has a lot to do even with distant production of sperm. Well, anyway, it's not difficult to reverse fatty liver before it's gotten to a scarring and really progressed stage. It's really pretty rapid and quick with nutritional interventions. You don't even need meds. But you can't go there if you don't know that the problem exists. Really important to realize that you can go to really good, well-intentioned, smart docs, but if they're not looking at what's going on really in your physiology with what's showing up in your lab, and also in how that connects with an intake, which of course we only get, 5, 6, 7-minute intakes, and usually by somebody who's an MA these days or somebody else. The doc only has a very cursory amount of time to be involved personally within that intake. So it's not exciting and wonderful that he had fatty liver, but it's wonderful that we found out that he had fatty liver. But if your liver's in distress, you want to know. And it's so reversible, which maybe will be another show. We won't go into that now. But what's so interesting is the Endocrine Society, which is a pretty conservative society, came out with a study in March of this year, 2018, saying that a man's semen count and his morphology, the shape of the semen, what shape is your semen in? Not if you're a woman, I mean if you're a guy. The man's semen is really a marker of his general health. And evaluating semen quality and function and motility are important in terms for men that are referred to fertility clinics, but it's also an indicator of a guy's general health. And this was a study that they did on 5,000, almost 200 male partners of infertile couples, and this took place in Italy, and it was presented at the Endocrine Society meeting in Chicago, of all places. Chicago's got a lot of meetings going on there, their 100th meeting, and they were able to show that men who had the lowest sperm count or alterations in sperm were much more likely to be heavier, to have higher blood pressure, to have more bad cholesterol, more triglycerides, less good cholesterol. Interesting. They had a higher frequency of metabolic syndrome. That's the cluster of the factors, the risk factors that can increase your risk of nasty stuff like diabetes, developing diabetes, heart disease, stroke. It has a lot to do with how well your insulin works, your PPAR gamma receptor. So it turned out that your sperm was reflective of your general health. They found that there was a 12-fold increased risk of insufficient testosterone that nobody picked up because nobody measures testosterone unless you beg, steal, and borrow your doc to do so. So half the men who had low sperm had low testosterone and even had osteoporosis. So they discovered that low sperm count itself, or problems with sperm, or infertility, was associated with poor measures of general health. And we don't usually look at things like that in today's medicine. We're so compartmentalized. And that really brings me to another study that I thought was very, very interesting that came out in Medscape, which is a very conservative online medical journal that goes out to over 5 million medical professionals around the world and usually tends to be very, very conservative. And they were discussing an article that had been published online in the Journal of Clinical Endocrinology and Metabolism. And they were taking a look at how come there's such a high rate of infertility in women while we're talking about infertility. In fact, there's about 30% of couples these days, and I write a lot about this in Hormone Deception, but about 30%, that's more than 1 out of 4 couples these days suffers from infertility. And they wanted to figure out, well, where's this idiopathic infertility come from? And that means even an idiot can't diagnose why you got it, but we're going to bill your insurance company anyway. So they discovered by looking at a whole bunch of women, and this study took place at the Massachusetts General Hospital at Harvard Medical School in Boston. And they took a look, and let me tell you, it was almost about 200 women, and they took a look at their thyroid levels. And they found that women who had unexplained infertility, in other ways called idiopathic infertility, but unexplained, they don't know why they can't conceive, had thyroid stimulating hormone, TSH, greater than 2.5, compared with people who didn't have trouble getting pregnant, who didn't have it that high, and greater than 2.5 is still within the normal range. But they said, hey, maybe women who can't conceive have a mild case of hypothyroidism that shows up at a lower level of normal within the range. The TSH is inversely related to thyroid function. As it goes higher, your thyroid function is lower. So they were saying there could be mild variations of thyroid dysfunction within the normal range that may be an important factor in fertility in women who have no known cause for their infertility. And so people who can't conceive, unexplained infertility is the inability to conceive for 12 months of trying. And what they said is they looked at almost 200 women, median age of 31 years, and they found that women with unexplained infertility had this high but normal TSH compared to controls. So they said, what this means is that perhaps there's an association between thyroid dysfunction at the high end of the normal range, but within the normal range. And this opens up an avenue of treating these women with thyroid, even though they're within the normal range, to see if that next step of lowering their TSH and improving their thyroid might help this group conceive. So what they're talking about is subclinical hypothyroidism, or hidden hypothyroidism that isn't showing up in the normal range of what would be considered hypothyroid, usually above 5 as a TSH, or sometimes a little bit lower like a 4. But when I worked with Dr. Block in Oklahoma, he would say totally normal TSH is about 1.78. And as it goes 2 and above, you really want to start taking a look at hypothyroidism, which is what this article is saying. And that's what functional practitioners have been saying for a very long period of time, that our levels of normal aren't optimal. Our reference ranges are based on millions of Americans who aren't necessarily healthy, and they're not based on science. So you want to treat the patient and not the lab. But usually if you go to the doc and say, I'm gaining weight, I'm feeling tired, I've got brain fog, you test my thyroid. And if he tests it and it's in the high normal, he'll say, you're fine, it's within normal. But maybe that high normal is not the optimal for you. Now that might be a bits and pieces that's really helpful for you. So you want an agile thinker who treats you and your situation and interprets the lab with you and your situation, seeing that lab through that lens. Lab through the lens. Lab through the lens. You want to see the lab through the patient's lens and not just an algorithmic lens. Now, one other bits and pieces that I wanted to share with you, and I would love your feedback. Don't forget, you can go to drlindsayberkson.com, and I've got a new gift for you all. I just love to cook. People have been asking me to open up restaurants for years, and I don't want to do it. Don't make me do it, but I love to cook. And when I've had a really rough day, I love to put the candles on, put the lights dimmed. To cook in a romantic atmosphere just makes me feel great. And invent. I see the kitchen as a lab, and I love to invent. So I've invented ways to get flax seeds into us that's easy, delicious, because flax seeds lower blood pressure. Flax seeds lower the risk of cancer in both men and women. Flax seeds are protective of our breast. If you have breast cancer, they protect against recurrence. If you're on tamoxifen, they sensitize the tumor to tamoxifen and make the tamoxifen work more powerfully. If you hadn't had cancer, they're protective against cancer, especially in postmenopausal women. They're high in precious omega-3 fatty acids. They're high in fiber. They're high in lignans, which really help control and modulate your estrogens in a very healthy way, and the same with the prostate, so they do it in both. So flax seeds aren't gender specific, they're gender politically correct. Really cool recipes, flour-free, seed-only muffin that's delicious as heck. In fact, somebody just wrote me that when they made it, they could barely stop eating all 12 that they made. I recommend you make up 12 or 24 and freeze them, and you can microwave them for 30 seconds, and they're get ready to go. I also have a flaxseed muffin on roids, which is the equivalent of 5 tablespoons per muffin in that flaxseed on roids muffin, and that's the dosage that's been found in the literature to cause tumors to shrink. There was one small study where they took women who'd just been diagnosed with breast cancer and had visualized and had the size of the tumor from digital mammography, and then they put them on that amount of flaxseed in flaxseed muffins, of all things, and then when they went to surgery, they were on the muffins for at least 6 weeks. So 5 tablespoons of flax seeds in a muffin delivery system for at least 6 weeks. And then when they went to surgery, they then reassessed the size of the tumor. And there was significant decrease across all of the women in the study that had been on the flax seeds. It's a very interesting, small little study. But there's multiple studies, and also in animal studies where it all first started. But there's a lot of research about flax seeds being a really great adjunctive care for all kinds of breast cancer interventions. So it's very breast protective, very prostate protective, but it's hard to figure out how to eat that much flaxseed and not throw up. So I've put together this muffin that's actually totally really delicious. So there's a flaxseed on Royd's muffin, especially great if you've been battling cancer or in the midst of it. And then I came up with a macadamia nut frosting and pudding, and there's research that came out in December of 2016 out of Mexico where they did a randomized trial of patients with inflammatory bowel disease showing that macadamia nut extract, which was used in the study, equivalent to a few tablespoons of macadamia nuts a day, could reduce inflammatory cytokines in the gut and even the genes of the inflammatory cytokines, and really act as powerful as a lot of pharmaceutical interventions for inflammatory bowel disease. So bottom line is MACs are very anti-inflammatory. They're very healing, and they have a very special type of omega-3 fatty acid called omega-7 fatty acid, not 3. Got my numbers off there. So I made a frosting that you can put on the muffins, or you can eat as a pudding, and I've got pictures of all this, and I explain how I first got inspired to come up with the seed-only muffins from when I was trekking around Australia 20-some years ago when I sold my first practice. And I've got a picture of me in Australia from 20-some years ago. So if you go to my website, drlindsayberkson.com, and you sign up to be on my community, you'll get that free ebook of all these really cool recipes. There's even a recipe for you to make seed cereal if you don't feel like making muffins and you want to get these into you. And if you are allergic to flax, because some people are reactive to flax, not a lot, but some people are, you can make all of these muffins or cereals out of chia seeds and other seeds and nuts. And I discussed that a little bit in this little ebook. So going on to our last bits and pieces for the day. It's all about agile thinking in complex cases. And so that's what you want. When you've got a problem that you can't get rid of, you've got a chronic problem, you got to figure out how to align yourself with somebody who will give you a set of fresh eyes to really help you see things in a different way. So I had a patient who was a middle-aged woman, as sweet as she could possibly be, who came forlorn as she could possibly be, because she'd been trying to take hormones for the last 15 years, and she had this reoccurring theme. She would go on the hormones, and for a short period of time, she would feel like her whole world, the sun came out, the clouds parted, the Mormon Tabernacle Choir was playing, and all was good with the world. And she felt like she knew she should feel, which was fantastic. And that would last about 3 or 4 weeks, and then she would tank like hell, not even have no libido. She would feel angry and have this negative viewpoint of her mate. It would almost hurt when she would attempt to get intimate. She would be very depressed. She couldn't control sugar cravings. She really felt miserable, and she couldn't get a handle on it. And she was a very smart, sophisticated, contemporized woman. But there was this pattern. So she'd go to one doc and take hormones in one delivery mode, and she'd be better, and then she'd be horribly worse. Then she'd go to another doc that would give hormones, little different recipe, different delivery mode. She'd feel great, and then she'd horribly tank. And she was getting worn out from the yo-yoing of up and down and up and down and up and down. So she had been referred to me by somebody that I know, and I listened to that pattern, and it suggested to me that she might be a person who can get the hormone delivered, whether it's topically or vaginally or orally, and then her liver goes into high gear and hyper-excretes it into the urine. So she might be what we call a hyperexcretor. People who can't hold on to their own hormones. For whatever reason, they get them into their body and then they lose them, and then they feel even worse because they've waned down to the bottom of the tank. Now, the way to diagnose a hyperexcretor of hormones is you have to do a blood test and a 24-hour urine test at the same time on the same day. And the picture would be if your blood levels of your hormones are very low, but your urine levels are unexpectedly high, which would show that you're rinsing your hormones out of your body and dumping them into the city sewage system. But, most doctors haven't been trained in that. It's not a way of looking at things. If someone's got a problem, well, they're not a candidate for hormones, or hormones are crazy anyway, or, just age gracefully anyway, or it's just, I don't have time to think that out. It's probably all in your head anyway. But I was mentored by Dr. Jonathan Wright, and he taught me this hyperexcretion, and it first came out in the literature with cortisol. Now, there's some people who have adrenal fatigue, not just because their adrenal glands make cortisol that's disrupted with circadian rhythm, but because they make it and they excessively excrete it. You can do this with a variety of hormones, but it was first published in the literature with the adrenal cortical hormone cortisol, because the adrenal gland is really two separate glands. There's the medulla in the center, and it makes its own set of hormones. And then there's the outer ring, the cortex, which makes its own set of hormones, cortisol being one. And then there's this fatty stripe around the whole thing, because it's really encased in fat. So your adrenal gland is very affected by toxins in your fat, because it's really encased in a seed of fat, which is where a lot of our hormone-altering chemicals go. So our adrenal glands and our thyroid are really, along with our pancreas, which is very heavy in fat, are very vulnerable to endocrine disrupting compounds that love fat. So I'd been trained by him that this can happen with adrenal hormones. This can happen with sex steroid hormones. And this can happen with a variety of hormones, but to assess whether that's the issue with a person, you have to run their blood levels of hormones and their 24-hour level of hormones at the same time. So we did that. It's a little costly because it's 2 sets of tests. And there it was in front of us, was really low levels of hormones in the blood and atypically elevated levels of hormones in the urine. And now there's a protocol with which to slow down hyperexcretion if you have it. And you go on that protocol, and it rights the wrong of the hyperexcretion over time. And it's a specific use of the mineral cobalt, which normally most people don't use today. When do you ever go, well, take 2 cobalts and call me in the morning? You don't do that too much. But that pretty much got the cycle of the down because it stopped the hyperexcretion. But you had to have somebody that had that experience and understanding that you might even possibly be a hyperexcretor. And then you had to have somebody who knew which tests to run to identify if you were, in fact, a hyperexcretor. And then you needed to have somebody who would have a tool bag for how you would dose and what you would use to rectify and resolve the issue of hyperexcretion. So these are a lot of bits and pieces, but if you go to 25 docs, you might get all 25 docs never even have heard of hyperexcretion or don't even believe in it. And then what are you going to do if that's really your issue in your tissues? So the whole idea is to try and find the right people that can help you get on the right path by identifying where you went off of it, how your body went off of it, and how to get you back on it. And that usually doesn't happen in 10-minute visits or with the algorithms that a lot of practitioners at this point for chronic health issues have available in their tool bag. Why? I don't know. It's not taught in schools. When I was teaching and putting together my Redefining Hormones in Today's Toxic World, a lot of gynecologists and family practice docs took that course, and they would say to me by the end of the course, why is it that we weren't taught this information in med school? And I don't know why that is. I don't know why that is, but that's why it's so cool today that we have summits, we have radio shows, we have so much available to us to learn things, but there is a lot of misinformation on the internet. And I might recommend something to a patient, and then they come back to me with stuff that they found on the internet that I know isn't really either accurate or accurate for them. So there's the plus of all the stuff we have available today, and there's always the negative of all the stuff we have available today, because we live in a world of duality where there's both sides to everything. From politics to medicine to lovemaking to cooking, there's two ways to skin a cat. So there's always two sides to everything. But what you want to do is try and see somebody who could see the whole bigger picture in both of your sides and all of your sides to help you out, which is why I thought it would be really cool to have the show today of Bits and Pieces. So I would love for you to, if you enjoy this show and this information, go to iTunes and give me a review. People write me that they have a problem putting reviews on iTunes. They did not make it easy. It is an IQ test, and all of us are flunking. So go to my website, drlindsayberkson.com, and after every podcast, I have a little set of notes about how you go about putting a review. If you'd like to get more information like this, more bits and pieces like this, and if you feel this adds to your life, your tool bag, and if you had some fun listening. Take care, everybody. Blessings. Bye.